20 hidden signs you might have diabetes. Here's what you need to know. Today, let's dive into a topic that might be affecting millions without their awareness: diabetes. Diabetes is a chronic condition that can silently disrupt your health, and recognizing its early signs could make all the difference. Diabetes occurs when your body struggles to regulate blood sugar, either due to insufficient insulin production or improper use of it. Many of its symptoms can be so subtle they're often mistaken for other conditions. That's why we're breaking down 20 telltale signs of diabetes you might be ignoring. Stick around, especially for number 18. It's surprisingly common, yet rarely associated with diabetes. What triggers diabetes? Understanding diabetes starts with knowing its causes. This condition comes in different forms, each with unique triggers. Type 1 diabetes. This autoimmune condition happens when the immune system mistakenly destroys insulin-producing cells in the pancreas. Although its exact cause remains unclear, a mix of genetic predisposition and environmental factors, like viral infections, are often at play. Type 2 diabetes. This is the most common type, where the body either becomes resistant to insulin or doesn't produce enough of it. Lifestyle factors like being overweight, physical inactivity, and an unhealthy diet play a significant role, but genetics also increase your risk. Gestational diabetes. This type develops during pregnancy, typically due to hormonal shifts and insulin resistance. While it often disappears after childbirth, it raises the risk of type 2 diabetes later in life. Ignoring diabetes isn't an option. It's not just about managing sugar levels, but protecting your entire body from long-term complications. Here's what untreated diabetes can lead to. Heart disease and stroke. Diabetes doubles the risk of heart attacks and strokes due to damaged blood vessels. Nerve damage, neuropathy, tingling, pain, or numbness in your extremities could escalate to severe infections or even amputation. Kidney failure. Diabetes is a leading cause of kidney disease, which might require dialysis or transplantation. Vision loss, retinopathy. High blood sugar can harm the blood vessels in your eyes, increasing the risk of blindness. Chronic wounds. Foot ulcers and infections are common, with diabetes being the leading cause of lower limb amputations worldwide. Skin issues. Infections and poor wound healing often indicate diabetes. Pregnancy risks. Uncontrolled diabetes during pregnancy can lead to complications for both mother and baby. Dental problems. Gum infections and tooth loss are more frequent in diabetics. Now, let's get to the heart of the matter: 20 signs that may indicate diabetes. These symptoms might seem ordinary at first, but their persistence should prompt a medical consultation. Excessive thirst. Constant dehydration is an early warning sign. Frequent urination, a result of your body trying to flush out excess sugar. Extreme hunger. Even after eating, your body might still crave energy it can't process. Unexplained weight loss, often seen in type 1 diabetes due to muscle breakdown. Fatigue. High blood sugar interferes with your body's ability to utilize energy efficiently. Blurred vision. Fluctuating sugar levels can temporarily affect your eyesight. Slow healing of cuts/wounds. Elevated sugar levels impair the healing process. Tingling or numbness, especially in your hands or feet. This could indicate nerve damage. Darkened skin patches, often seen in the neck or armpits, a condition called acanthosis nigricans. Frequent infections. From UTIs to skin infections, diabetes weakens immunity. Irritability. Unstable sugar levels can affect your mood. Dry mouth, a lesser known but common symptom. Yeast infections, caused by high sugar levels, which promote fungal growth. Sudden vision changes. Persistent issues warrant immediate attention. Itchy skin, especially on the lower extremities. Fruity smelling breath, often a sign of diabetic ketoacidosis, a medical emergency. Increased cravings for sweet foods. Ironically, this can indicate your body's struggle to process sugar. Skin tags, harmless but sometimes linked to insulin resistance. Cold hands and feet, poor circulation caused by diabetes. Chest pain or shortness of breath could indicate cardiovascular complications linked to diabetes. If you notice any of these signs, don't wait, schedule a medical checkup. A simple blood test can provide clarity. Common tests include fasting glucose test. measures blood sugar levels after fasting overnight. Oral glucose tolerance test tracks how your body processes sugar after a glucose-rich drink. Hemoglobin A1C test provides a 3-month average of your blood sugar levels. Sign 1. Excessive thirst. What your body might be telling you. Excessive thirst, or polydipsia, is often the first noticeable symptom of diabetes. When blood sugar levels spike, the kidneys struggle to process and reabsorb the surplus glucose. This leads to a chain reaction. Excess glucose is expelled through urine, resulting in fluid loss and triggering the body's need to replenish it. This isn't just an occasional craving for water. It's a persistent and unrelenting thirst that stands out from the norm. What's fascinating is how this thirst cycle unfolds. As glucose builds up in the bloodstream, it draws water from tissues, further amplifying dehydration. Consequently, the body urges you to drink more, yet the cycle continues. According to a 2023 study, nearly 70% of newly diagnosed diabetes cases reported polydipsia as an early symptom. For many, this excessive thirst is accompanied by frequent urination, often disrupting sleep and daily routines. Beyond being a warning sign, untreated excessive thirst can have serious consequences. Dehydration doesn't just leave you parched. It can result in fatigue, dizziness, and even cognitive impairment. In extreme cases, prolonged dehydration, due to underlying conditions like diabetes, may require medical intervention. Awareness and timely action are key to avoiding complications. Think about how disruptive this symptom can be. For instance, constantly waking up at night to drink water or use the bathroom can interfere with your sleep cycle, leaving you drained the next day. Over time, poor quality sleep can snowball into other health issues, such as weakened immunity or mood swings. The body sends clear signals when something's wrong, and recognizing excessive thirst as a red flag could make all the difference. If you notice you're drinking far more water than usual without any clear reason, don't ignore it. While thirst is often harmless and linked to common factors like exercise or hot weather, persistent or extreme thirst should prompt further investigation. It's not just about quenching your thirst. It's about uncovering what your body is trying to tell you. We're all in this journey of learning to listen to our bodies. Paying attention to symptoms like polydipsia can empower us to seek early medical advice, potentially preventing long-term complications. Stay curious about the signs, and remember, even subtle changes might hold the clues to better health. Sign 2. Frequent urination. Have you ever found yourself running to the bathroom more than usual, even during the night? Frequent urination, known as polyuria, can be one of the key signals that our body is dealing with an underlying issue like high blood sugar. When blood sugar rises, our kidneys work overtime to flush out the excess glucose through urine. This natural process increases urine production, which might have us waking up multiple times each night or constantly searching for the nearest restroom. This isn't just an inconvenience. It impacts how we feel day to day. Research shows that 79% of people experiencing frequent urination report sleep disturbances. Interrupted rest doesn't just make us tired. It affects our mood, memory, and energy levels. Imagine struggling to focus or feeling irritable all because your body couldn't get the restorative sleep it needed. Over time, this cycle can lead to exhaustion, leaving us feeling like we're running on empty. Another factor we need to consider is how frequent urination can cause dehydration. Every extra trip to the bathroom drains our body of fluids, which can leave us feeling parched and craving water. Drinking more might seem like the solution, but it can also perpetuate the cycle. Dehydration, even mild, has been shown in studies to reduce physical performance and cognitive function by as much as 20%. So while we hydrate to feel better, our bodies remain stuck in a frustrating loop. It's worth mentioning that frequent urination isn't always tied to high blood sugar. Other conditions, such as urinary tract infections, UTIs, kidney issues, or an enlarged prostate, can lead to similar symptoms. For example, statistics reveal that 40% of men over 60 report increased urination due to prostate enlargement. Knowing this helps us understand that while this sign is important, it isn't definitive without considering other symptoms. If frequent urination comes with additional signs like persistent thirst, sudden weight loss, or fatigue, it's time to take action. Seeing a healthcare provider for a simple blood sugar test can provide clarity. Early detection of diabetes is crucial. In fact, the Centers for Disease Control and Prevention, CDC, states that identifying diabetes early can reduce complications by up to 70%. This highlights the importance of being proactive with our health. Frequent urination might feel like a minor nuisance, but it can be a signal worth investigating. By recognizing these patterns and seeking help when needed, we're not just addressing the symptom, we're taking charge of our well-being. Sign 3. Excessive hunger. Let's talk about something that might feel familiar, but often gets overlooked: excessive hunger. It's not just about craving snacks or indulging in an extra slice of pizza. We're diving into polyphagia, one of the key signs of diabetes that often goes unnoticed. When your body struggles to use glucose effectively, it sends relentless signals to your brain, urging you to eat more. Imagine finishing a full meal only to feel hungry again within minutes. It's confusing and exhausting. This happens because, even with high levels of glucose in your bloodstream, your cells can't access it for energy. It's like having a pantry full of food, but no key to open it. Insulin, which acts as that key, either isn't being produced in sufficient amounts or isn't working properly due to resistance. So, your body keeps calling for more food, mistakenly thinking the energy deficit can be solved by eating more. What's even more challenging is the domino effect this can create. Frequent and uncontrollable hunger often leads to overconsumption, particularly of calorie-dense comfort foods. This might temporarily ease that gnawing feeling, but it also leads to weight gain. And here's the kicker. Gaining weight can make insulin resistance even worse, trapping you in a frustrating cycle that's hard to break. Studies reveal just how interconnected hunger and diabetes can be. According to a 2023 report from the International Diabetes Federation, about 70% of individuals newly diagnosed with type 2 diabetes experience polyphagia as an early symptom. It's a powerful reminder of how essential it is to recognize and address this sign before it spirals into larger health issues. Addressing excessive hunger isn't just about willpower. It's about understanding what your body is trying to tell you. Seeking professional guidance, tracking your eating patterns, and focusing on low glycemic, nutrient-dense foods can help stabilize your blood sugar levels. This, in turn, can reduce those relentless hunger signals. So, if you or someone you care about has been struggling with constant hunger, don't ignore it. Think of it as your body waving a flag, urging you to take action. Sign 4. Unexplained weight loss, a critical sign you shouldn't ignore. Unexplained weight loss can serve as a crucial warning sign of diabetes, particularly type 1 diabetes. It's not just about shedding a few pounds. This change happens when the body struggles to get energy from glucose. When glucose is unavailable for fuel, the body turns to fat and muscle reserves, leading to rapid and noticeable weight loss, even in individuals maintaining a normal diet. It's a red flag we should all recognize. In type 1 diabetes, the body cannot produce insulin, a hormone essential for glucose absorption. Meanwhile, in type 2 diabetes, the issue lies in the body's inability to use insulin efficiently. In both cases, cells are deprived of glucose, forcing the body to find alternative energy sources. The result? Significant muscle and fat breakdown, which often manifests as an alarming loss of weight over a short period. Studies highlight how prevalent this symptom can be. For instance, research published by the Centers for Disease Control and Prevention, CDC, indicates that about 10% of type 1 diabetes cases present with unexplained weight loss as one of the first signs. For context, a person might lose 10 to 20 pounds within just a few weeks, despite maintaining or even increasing their calorie intake. The striking aspect of this symptom is its timing. It often emerges suddenly. If you notice unexplained weight loss, especially if it's accompanied by other signs like fatigue or excessive thirst, it's essential to consult a healthcare professional promptly. Early diagnosis and intervention can make a huge difference in managing the condition effectively. Understanding the science behind this is eye-opening. Glucose, our body's primary fuel, becomes inaccessible without insulin. Imagine a car with a full tank of gas, but no spark to ignite it. The body then resorts to breaking down its reserves, leading to noticeable physical changes. Knowing this mechanism can help us recognize when something feels off and take action sooner. Being informed about these signs could save lives. Diabetes is a serious condition, but early detection makes it manageable. If you or someone you know experiences unexplained weight loss alongside other potential symptoms, don't hesitate, get it checked. The sooner we address it, the better equipped we are to maintain our health and well-being. Sign 5. Fatigue. A hidden signal your body might be sending. Fatigue is something we all experience from time to time. However, if that tiredness feels like it never quite goes away, even after a full night's rest, it might be more than just a bad night's sleep. Fatigue is a common but often overlooked symptom of many health conditions, with diabetes being one of the primary culprits. According to recent studies, nearly 50% of people with diabetes report feeling consistently tired, which significantly impacts their daily lives. So, why does fatigue become such a persistent issue in diabetes? Well, it all comes down to how our bodies handle glucose, the primary source of energy. In people with diabetes, the body struggles to properly use glucose for fuel. Without sufficient energy reaching the cells, tiredness becomes a constant companion. This energy mismatch occurs due to issues like insulin resistance or insufficient insulin production, two common problems in diabetes. When insulin isn't working as it should, glucose remains stuck in the bloodstream rather than being absorbed by the cells, leaving you feeling drained. On top of that, another factor that contributes to diabetes-related fatigue is dehydration. Frequent urination, a hallmark symptom of diabetes, leads to fluid loss, which can worsen feelings of exhaustion. The body loses essential electrolytes, leaving you more dehydrated and even more tired. Dehydration has a direct impact on your energy levels, as water is crucial for various bodily functions, including nutrient transport and waste removal. The more dehydrated you are, the less efficiently your body can operate, and that means more fatigue. Fatigue isn't just about feeling tired. It can drastically reduce your quality of life. If you constantly struggle with exhaustion, it can be hard to focus at work, enjoy family time, or even keep up with hobbies you once loved. Over time, this persistent fatigue can lead to mood changes, like irritability or depression, making everyday life feel like a constant uphill battle. It's more than just a lack of sleep. It's a signal that something deeper could be going on within your body. So, what should you do if fatigue is affecting your life? The key is to listen to your body. If you're feeling perpetually tired without a clear reason, it's important to seek medical advice. A healthcare professional can help identify whether diabetes, or another condition, might be at the root of your tiredness. Simple blood tests and a thorough checkup can provide valuable insights and help set you on the right path to feeling better. Remember, fatigue might seem like a minor issue, but it can be a warning sign that should never be ignored. Taking action early is crucial in managing any underlying health problems and improving your overall well-being. So, if fatigue is dragging you down, don't hesitate to reach out to a doctor and get the answers you need to regain your energy and zest for life. Sign 6. Blurred vision, a red flag for diabetes. Let's talk about blurred vision. It's one of the most common early signs of diabetes, and it's easy to overlook. High blood sugar levels can cause the lenses in your eyes to swell, making it harder to focus clearly. While some people may experience temporary blurred vision, this symptom should not be dismissed. If left untreated, it can lead to severe eye issues, including a condition called diabetic retinopathy. Here's what happens. When blood sugar levels rise, glucose builds up in the lens of the eye. This excess sugar draws in water, causing the lens to swell. When this happens, the lens can no longer focus properly, resulting in blurry vision. Interestingly, studies show that nearly 60% of people with diabetes experience some form of vision change, and blurred vision is often one of the first noticeable signs. But here's the thing, if you notice blurry vision and take action by controlling your blood sugar, it can often improve. Many people see their vision return to normal once they get their glucose levels under control. This is why regular monitoring of blood sugar is so important, especially if you already have diabetes or are at risk. On the flip side, if blood sugar remains high for long periods, the risk of permanent damage to your eyes becomes a real concern. The longer you have high blood sugar without addressing it, the more likely it is that the small blood vessels in the retina will start to deteriorate. This leads to diabetic retinopathy, a condition that affects roughly 1 in 3 people with diabetes. Diabetic retinopathy is a leading cause of blindness in adults, and it can develop without noticeable symptoms until the damage is severe. In fact, a study from the National Eye Institute found that over 7.7 million Americans are affected by some form of diabetic retinopathy. The good news is that we can significantly reduce the risk of permanent vision loss if we catch it early. Regular eye exams are crucial because they can help detect diabetic retinopathy in its early stages, before it does serious damage. For example, if you have diabetes, experts recommend getting a comprehensive eye exam at least once a year to check for signs of eye problems. By staying on top of your health, you can catch any potential issues early and protect your vision. Sign 7. Slow healing, a hidden warning sign of diabetes. One of the lesser-known signs of diabetes is slow healing. If you notice that cuts, scrapes, or even small wounds take longer than usual to heal, it might be time to pay closer attention. High blood sugar levels, a hallmark of diabetes, can disrupt the body's natural healing process, leading to slower recovery times and a higher risk of complications. This can be a real concern, especially when wounds become infected or don't heal properly, making it crucial to act early. When blood sugar levels remain elevated over time, they can damage blood vessels and nerves. This damage restricts proper blood flow, which is necessary for delivering oxygen and nutrients to the wound site. As a result, the body struggles to repair itself effectively. Research shows that people with diabetes experience slower wound healing due to the reduced ability of immune cells to fight infections. In fact, studies suggest that diabetic individuals are 3 to 4 times more likely to suffer from chronic wounds compared to those without the condition. Wounds, even minor ones, can turn into serious issues. Slow healing can lead to ulcers, particularly on the feet, where circulation tends to be weaker. These ulcers are not only painful, but also challenging to treat. According to the American Diabetes Association, around 15% of people with diabetes will develop a foot ulcer in their lifetime. If not carefully managed, foot ulcers can lead to severe complications, including infections that may result in amputation. The link between poor wound healing and diabetes highlights the importance of monitoring any injuries, regardless of size. It's not just about waiting for a wound to close. It's about ensuring the healing process is happening effectively. If you're living with diabetes, take extra care with your feet, as they are most vulnerable to circulatory problems. Always inspect them regularly, especially after long periods of sitting or standing, to spot any cuts or abrasions early. So, what should we do if we notice slow healing? First and foremost, it's crucial to keep blood sugar levels in check. Regular monitoring and a balanced diet are key to managing diabetes effectively. Next, pay attention to wound care. Clean and dress wounds properly, and don't hesitate to reach out to a healthcare professional if you notice unusual symptoms or signs of infection. They can help guide you through the process and prevent further complications. Sign 8. Frequent infections, a hidden diabetes warning. If you're dealing with frequent infections, it might be a sign that your blood sugar is out of control. Particularly, urinary and skin infections can often point to underlying diabetes. Elevated blood sugar creates an environment where bacteria and fungi thrive, making infections harder to fight off. The link between high glucose levels and recurring infections is something that too many people overlook. Urinary tract infections, UTIs, are especially common in people with diabetes. High blood sugar levels spill into the urine, providing the perfect conditions for bacterial growth. Studies show that people with diabetes are up to 3 times more likely to get UTIs than those without the condition. Symptoms like burning during urination, frequent urges to go, and cloudy or foul-smelling urine are telltale signs. If you notice any of these symptoms, it's crucial to check your blood sugar levels as soon as possible. Skin infections are another frequent issue for people with diabetes. Conditions such as boils, abscesses, and fungal infections are more common. Why? Because elevated blood sugar weakens the immune system, making it harder for the body to fight off infections. Research has found that people with diabetes take up to 50% longer to heal from wounds and infections. This slower recovery process can turn small infections into bigger problems if left untreated. The real issue behind these infections is how diabetes affects the immune system. High blood sugar impacts the body's ability to produce white blood cells, which are essential for fighting off infections. As a result, we become more vulnerable to bacteria and fungi. In fact, studies have shown that nearly 25% of people with diabetes experience skin infections annually, a staggering number that highlights the seriousness of this issue. Another factor at play is poor circulation. Diabetes can cause blood vessels to become less efficient, meaning that immune cells have a harder time reaching areas of infection. This impaired blood flow delays healing, allowing infections to linger longer. And when wounds don't heal properly, they become breeding grounds for bacteria, which can lead to even more serious complications down the line. If you're experiencing frequent infections, it's time to take control of your health. The good news is that managing your blood sugar can significantly reduce your risk of infections. With proper monitoring and treatment, you can prevent these complications and improve your overall quality of life. Sign 9. Dry skin and itching, a hidden sign of diabetes. Let's talk about something many people overlook: dry skin and itching. If you've noticed your skin becoming excessively dry, flaky, or irritated, it could be more than just a skincare issue. For those with diabetes, these symptoms might be a sign of something deeper happening in the body. Studies show that up to 30% of individuals with diabetes experience dry skin, making it a common but often unnoticed indicator. Dehydration plays a key role here. When blood sugar levels are too high, it can lead to frequent urination, which ultimately dehydrates the body. This dehydration reduces the moisture your skin needs, making it prone to dryness. The lack of hydration can cause your skin to become rough and uncomfortable, often leading to that tight feeling we all dread. Even the slightest touch can be uncomfortable when your skin is this dry. It's not just dehydration at play though. Poor circulation, a common complication of diabetes, can also impact skin health. The blood flow to your skin decreases, meaning it struggles to get the nutrients it needs. This creates a perfect environment for itching, rashes, and even infections. In fact, one study found that nearly 60% of people with diabetes will experience some form of skin issue due to poor circulation. If you've ever found yourself scratching intensely, especially around your legs and feet, you might be dealing with diabetic neuropathy. This nerve damage, caused by high blood sugar, can trigger intense itching in specific areas. It's more than just an annoying sensation. It's a sign that the nerves in those areas are struggling. Neuropathic itching can sometimes be so severe that it becomes difficult to sleep or concentrate on anything else. There are several factors that can make this condition worse. Hot showers or baths, harsh soaps, and low humidity can all dry out your skin even more. These daily habits might seem harmless, but for those with diabetes, they can lead to greater discomfort. It's important to take extra care when it comes to skin health, especially when diabetes is part of the picture. So, what can we do about it? Keeping skin moisturized is essential. Make sure to drink plenty of water, use gentle, hydrating soaps, and apply moisturizers regularly. If you notice itching or dryness that doesn't improve, it's a good idea to speak with a healthcare professional. Catching these signs early can make a big difference in managing your skin health and overall diabetes care. Sign 10. Tingling and numbness, the warning your body might be sending you. Let's talk about something that might seem harmless at first, but could be signaling something much more serious. Tingling and numbness in the hands and feet. We've all experienced that annoying pins and needles feeling, but when it happens more frequently, it might be time to pay attention. This sensation, also known as neuropathy, could be a red flag for diabetes. Studies suggest that nearly 50% of people with diabetes will experience some form of nerve damage over time. It's a clear indicator that we need to take our health seriously before things get worse. When blood sugar levels remain high over a prolonged period, they can begin to damage our nerves. This nerve damage is what causes the tingling, numbness, or even sharp pain, especially in the extremities like the hands and feet. It's known as diabetic neuropathy, and it's one of the most common complications of diabetes. In fact, Around 60 to 70% of people with diabetes will develop some level of neuropathy. This damage isn't just uncomfortable, it can significantly affect mobility and quality of life if ignored. There are different types of neuropathy, but the most common in diabetes is peripheral neuropathy. This affects the nerves outside the brain and spinal cord, particularly those in the hands, feet, and legs. The early signs can be subtle, like that occasional tingling feeling. But over time, it can worsen, leading to muscle weakness, difficulty walking, and even loss of balance. Imagine trying to walk, but every step feels unsteady or painful. It's a reminder that taking control of blood sugar levels is vital to prevent further damage. But here's where things get more complicated. There's also autonomic neuropathy, which affects the nerves that control involuntary functions like digestion, bladder control, and heart rate. If you're experiencing digestive issues, urinary incontinence, or erectile dysfunction, autonomic neuropathy could be at play. While it might seem unrelated to the tingling in your feet, both forms of neuropathy share a common cause: high blood sugar damaging the nerves. It's crucial to understand that these issues can affect more than just your extremities. What's concerning is that neuropathy can develop slowly, often without noticeable pain at first. In the early stages, the tingling might be occasional and easy to dismiss. However, according to the American Diabetes Association, this kind of nerve damage can lead to more severe complications, including infections and amputations, if left untreated. The longer we wait to address the issue, the greater the risk of it impacting our lives in serious ways. Sign 11. Dark spots on the skin. Have you ever noticed dark patches appearing on your skin, especially in areas like your neck, armpits, or around the folds of your skin? These dark spots could be more than just a cosmetic concern. They might be an early warning sign of insulin resistance. Insulin resistance is a condition where the body's cells don't respond properly to insulin, and it often leads to the development of type 2 diabetes if left unchecked. One of the telltale signs of this issue is a condition called acanthosis nigricans. Acanthosis nigricans manifests as dark, velvety patches that typically appear in areas where skin rubs together, such as the neck, armpits, groin, and joints. These patches are not just a matter of pigmentation. They're a direct response to higher than normal insulin levels in the body. Insulin resistance forces the body to produce more insulin, which in turn triggers the skin's cells to multiply, leading to thickened and darkened areas. Interestingly, acanthosis nigricans is often seen as an early indicator of diabetes risk. According to the American Diabetes Association, about 30 to 40% of people with insulin resistance or type 2 diabetes develop this condition. It's often one of the first physical clues that blood sugar regulation is off balance, even before more severe symptoms of diabetes appear. So, spotting these dark spots early can help you take action before things progress. While acanthosis nigricans itself doesn't cause any direct symptoms, like itching or pain, it can be quite unsightly. The patches can be thick, and their appearance might make some people feel self-conscious. But more importantly, the presence of these dark spots signals that the body is struggling to manage blood glucose levels effectively. It's a red flag that shouldn't be ignored. If you notice these spots on your skin, especially if they appear suddenly or in multiple areas, it's a good idea to consult with a healthcare professional. The good news is that with early intervention, insulin resistance, and even type 2 diabetes can often be managed or even reversed. Lifestyle changes, including a healthier diet and more regular physical activity, can significantly improve insulin sensitivity. Studies show that losing just 5 to 10% of your body weight can improve insulin function and lower blood sugar levels. In fact, research from the Diabetes Prevention Program has shown that these simple changes can reduce the risk of developing type 2 diabetes by up to 58%. Sign 12. Mood changes. We all experience mood swings from time to time, but for those with diabetes, emotional fluctuations can be much more frequent and intense. Did you know that irritability and unexplained mood changes can actually be a sign of diabetes? Studies have shown that the way our body responds to fluctuating blood sugar levels plays a direct role in how we feel emotionally. Both high and low blood sugar can cause emotional roller coasters, making it challenging to maintain a stable mood. When blood sugar levels are high, or hyperglycemia, we may start to feel more irritable and anxious. In fact, research from the American Diabetes Association shows that nearly 40% of people with diabetes experience anxiety related to blood sugar spikes. The lack of energy and overall mental fatigue that comes with high glucose levels can make us more prone to frustration, stress, and even a sense of dread. It's like our body is struggling to keep up, and that can really take a toll on our emotional state. On the other hand, low blood sugar, or hypoglycemia, brings its own emotional challenges. Sudden drops in blood glucose levels can lead to feelings of nervousness, confusion, and agitation. According to a 2019 study published in the Journal of Diabetes Research, up to 50% of people with diabetes report experiencing emotional distress due to hypoglycemia. This feeling of being out of control can be overwhelming, and it's something many people with diabetes face on a daily basis. What's important to remember is that these mood changes are not just about having a bad day. They are often a direct result of our body's reaction to blood sugar imbalances. But the good news is that we can take steps to manage them. Properly controlling blood glucose levels can significantly reduce the intensity of these emotional swings. Staying on top of our diet, exercise, and medication is key to keeping those blood sugar levels stable and, in turn, maintaining emotional balance. It's also crucial to address the emotional side of things. Having a support system is more important than we often realize. Emotional support can come from friends, family, or even professional therapy. It's not just about stabilizing our blood sugar, it's about managing the emotional impact of the condition. Studies show that therapy and counseling can play a huge role in improving emotional well-being for people living with diabetes. Sign 13. Oral infections and diabetes. Oral health can reveal surprising clues about our overall well-being, especially for people living with diabetes. One of the common but often overlooked signs of diabetes is the occurrence of oral infections. Conditions like gingivitis and periodontitis tend to develop more frequently in individuals with high blood sugar. In fact, studies show that up to 50% of people with diabetes may experience some form of gum disease, a stark reminder of how blood sugar levels can directly impact oral health. Why does this happen? Elevated blood glucose levels create an environment in the mouth that's ideal for bacteria to thrive. When blood sugar is too high, it spills over into saliva, turning it into a breeding ground for harmful bacteria. These bacteria can then infect the gums, leading to gingivitis, which is the first stage of gum disease. The symptoms are hard to miss: redness, swelling, and bleeding in the gums. But don't let the initial signs fool you. If left unchecked, gingivitis can escalate into periodontitis, a far more severe condition. This advanced stage of gum disease can cause significant damage to the tissues and bones that support our teeth, potentially leading to tooth loss. Research suggests that individuals with uncontrolled diabetes are not only more likely to develop periodontitis, but also face a slower healing process, making it even more difficult to manage oral infections effectively. So, what can we do to prevent these oral health issues from spiraling out of control? First and foremost, maintaining a solid oral hygiene routine is crucial. Brushing twice a day, flossing regularly, and scheduling routine dental checkups are essential habits for anyone with diabetes. These simple practices can dramatically reduce the buildup of plaque and bacteria in the mouth, lowering the risk of infection. But oral hygiene alone isn't enough. It's equally important to focus on managing blood sugar levels. Keeping glucose levels within the recommended range doesn't just protect our overall health. It also plays a significant role in reducing the risk of gum disease. The American Diabetes Association emphasizes that people with well-controlled blood sugar levels experience fewer oral health complications compared to those with fluctuating or high blood sugar levels. Sign 14. Inflamed gums. A signal you shouldn't ignore. Did you know that inflamed, red, or sensitive gums might be more than just a dental problem? They can actually point to an underlying condition like diabetes. Our mouths often act as mirrors for our overall health, and gum issues are one of the early warning signs that shouldn't be dismissed. When we understand this connection, we can take better steps to protect both our oral and general health. Diabetes affects how our body handles infections, making us more prone to gum issues. Research shows that individuals with diabetes are nearly twice as likely to develop gum disease compared to those without the condition. That's because high blood sugar levels weaken our immune system, leaving us vulnerable to bacterial infections. Inflamed gums, known as gingivitis, can be one of the first signs of this process. If gingivitis isn't managed, it can progress to periodontitis, a more severe gum disease. Periodontitis not only damages the gums, but also harms the bones and tissues supporting our teeth. Studies reveal that nearly 22% of people with diabetes experience severe gum disease, which can even lead to tooth loss. What's worse is that periodontitis may create a cycle where gum problems make it harder to manage blood sugar levels, intensifying the risk of complications. What makes diabetes such a challenge for oral health? Elevated glucose levels in saliva provide the perfect breeding ground for harmful bacteria. On top of that, a slower healing process in those with diabetes makes it harder to recover from infections. This combination creates a snowball effect, where untreated gum problems can spiral into bigger health concerns. The good news is that we can take control. Maintaining excellent oral hygiene is essential, especially if diabetes is in the mix. Brushing thoroughly twice a day, flossing daily, and scheduling regular dental checkups are powerful habits. At the same time, managing blood sugar levels is equally important. Studies show that well-controlled diabetes can significantly reduce the risk of gum disease, improving not just our oral health, but our overall well-being. Sign 15. Nausea and vomiting. What your body might be telling you. Let's talk about something many of us have experienced: nausea and vomiting. While these symptoms can have many causes, they can also be early warning signs of diabetes. When paired with other symptoms like constant thirst and frequent urination, it's important to take them seriously. High blood sugar levels can trigger nausea, but there's a deeper issue at play here, one that could be life-threatening if ignored. The root cause often lies in diabetic ketoacidosis, or DKA. This condition develops when our bodies lack insulin to use glucose for energy. Instead, fat is broken down, producing ketones as a byproduct. While small amounts of ketones aren't harmful, high levels can quickly turn dangerous. According to a 2021 study, up to 30% of new diabetes cases in children present with DKA, underscoring how common and serious this complication can be. It's a silent alarm that shouldn't go unnoticed. When ketones build up in the bloodstream, the effects can be severe. Along with nausea and vomiting, we might experience stomach pain, deep or rapid breathing, or even confusion. In some cases, people report a fruity smell on their breath, a classic sign of high ketone levels. It's worth noting that untreated DKA can escalate quickly, potentially leading to coma or worse. This is why prompt action is so critical. If this sounds intense, that's because it is. DKA is classified as a medical emergency, and we shouldn't wait for symptoms to worsen. According to the Centers for Disease Control and Prevention, nearly 2 out of every 1,000 adults with diabetes in the US experience DKA each year. While the numbers may seem small, the risk increases without proper management of blood sugar levels. The good news is that early intervention can prevent severe outcomes. So, what should we do if these signs appear? First, hydration is key, as vomiting can lead to dehydration, further complicating the situation. Next, seeking immediate medical care is essential. Healthcare providers will check blood sugar levels, test for ketones, and stabilize the body with fluids and insulin therapy. Ignoring these symptoms or delaying care can have lasting consequences, so acting swiftly is our best defense. Sign 16. Dry mouth. Have you ever noticed a persistently dry mouth that feels more than just thirst? Dry mouth, scientifically termed xerostomia, might be an indicator of diabetes. This condition arises when dehydration, often triggered by frequent urination, a common diabetes symptom, leaves the body struggling to produce sufficient saliva. It's not just an annoyance, it's a sign worth paying attention to. Saliva is vital for oral health, and its absence can lead to a cascade of issues that deserve our attention. Why does saliva matter so much? It's the unsung hero of our mouths. Saliva neutralizes harmful acids created by bacteria, reducing the risk of cavities and gum diseases like gingivitis. It even aids in swallowing, chewing, and maintaining a healthy oral environment. When saliva production dips, the risks escalate. Studies reveal that people with xerostomia face a significantly higher chance of developing cavities and oral infections. This highlights the importance of addressing dry mouth as part of a broader health conversation. Let's not forget the potential impact on daily life. Dry mouth can make simple activities, like speaking, eating, or even smiling, uncomfortable. This discomfort can feel constant, affecting confidence and well-being. In 2022, oral health surveys indicated that about 30% of individuals with diabetes reported regular dry mouth symptoms. This statistic alone underlines the connection and the need to tackle it effectively. What steps can help? Staying hydrated is a great first line of defense. Water keeps our systems balanced, but certain habits can make a difference too. Avoiding caffeine and alcohol, which can worsen dehydration, is key. Alcohol-free mouthwashes can also be a game changer, as they prevent further drying while maintaining oral hygiene. These small, mindful choices help create a healthier environment in your mouth. For those struggling with persistent symptoms, professional advice is invaluable. Dentists and doctors often recommend specialized products, such as saliva stimulants or prescription rinses. These treatments not only provide relief, but also protect against long-term complications. Early intervention can transform the experience of managing dry mouth, giving back comfort and confidence. Sign 17. Bleeding gums. Have you ever noticed your gums bleeding after brushing or flossing? If you have, you might want to pay closer attention. This seemingly small symptom could actually point to something much bigger, like diabetes. When blood sugar levels are high, they can impact our gum health in ways we might not even realize. Our gums can become more vulnerable to infections and inflammation, leading to bleeding. It's not just uncomfortable, it's a sign our bodies might need extra care. The connection between diabetes and gum disease is stronger than many realize. According to the American Diabetes Association, people with diabetes are more likely to experience gum disease. And not just a little. Research shows they're up to 3 times more likely to develop severe gum problems compared to those without the condition. This happens because high blood sugar weakens our immune system, making it harder for the body to fight off harmful bacteria in the mouth. The result? Conditions like gingivitis, where gums become inflamed, swollen, and start to bleed. But what happens if gingivitis isn't treated? Left unchecked, it can progress into something much worse, periodontitis. This is a more severe form of gum disease that affects the bones and tissues supporting your teeth. Not only does it lead to discomfort, but it can also cause tooth loss and long-term damage. The Centers for Disease Control and Prevention, CDC, reports that nearly half of all American adults aged 30 and older show signs of gum disease, and as we age, that number only increases. This means that bleeding gums are more common than we think, and there's something we shouldn't ignore. The good news? Preventing gum disease is entirely possible, and it starts with taking control of both our oral hygiene and our blood sugar. Brushing and flossing daily, as well as visiting the dentist regularly, are essential to maintaining healthy gums. But managing blood sugar levels is just as critical. When blood sugar is well controlled, it helps the body fight off infections more effectively. Studies show that keeping blood glucose levels stable significantly reduces the risk of gum disease. On the flip side, when gum disease is left untreated, it can actually make managing blood sugar more difficult, creating a vicious cycle. If you're noticing frequent gum bleeding, don't wait for it to go away on its own. A dentist can help assess the situation and provide you with the right treatment plan. This could include professional cleanings or specific instructions for improving your at-home dental care. For those with diabetes, maintaining consistent dental visits is even more important to monitor and treat any issues before they worsen. After all, gum health isn't just about having a bright smile. It's about taking care of the body as a whole. Sign 18. Struggling with focus. Have you ever felt like your mind is in a fog, unable to focus or retain information? Difficulty concentrating can be an overlooked but telling symptom of diabetes. This challenge often stems from unstable blood sugar levels, which disrupt the brain's ability to function at its best. Studies show that both hyperglycemia, high blood sugar, and hypoglycemia, low blood sugar, can impair cognitive functions like attention and memory. In fact, research published in Diabetes Care found that people with diabetes are 20 to 30% more likely to experience cognitive challenges. When blood sugar fluctuates wildly, it's not just our energy levels that take a hit. Our mental clarity does too. Symptoms such as confusion, dizziness, and even blurred vision can make it tough to complete everyday tasks. Imagine trying to focus on a work project or engage in a meaningful conversation, only to feel your thoughts slipping away. These neurological effects aren't just frustrating, they can have a tangible impact on our productivity and quality of life. Maintaining stable blood glucose levels is key to regaining mental sharpness. Balanced, regular meals, packed with fiber, protein, and healthy fats, can prevent the spikes and crashes that throw us off track. Physical activity also plays a critical role, as exercise improves insulin sensitivity and boosts circulation, supporting both the body and brain. A 2017 study highlighted how moderate exercise, even a brisk 30-minute walk, can enhance cognitive performance for those managing diabetes. But it's not only about physical changes, emotional well-being matters too. Diabetes can be mentally draining, leading to anxiety or even depression, which further affects our focus. Seeking guidance from a mental health professional can provide tools to handle these emotional hurdles. This support can make a world of difference, especially when paired with practical strategies for managing stress. We've all felt scatterbrained at times, but if concentration problems become persistent, it's worth digging deeper. For those living with diabetes, recognizing the link between blood sugar and brain function is empowering. It reminds us that with proactive care, we can navigate these challenges effectively. When we prioritize our health, through proper nutrition, exercise, and mental support, we give ourselves the chance to thrive, both mentally and physically. Difficulty concentrating doesn't have to hold us back. With small but intentional steps, we can reclaim our focus and get back to living fully. Sign 19. Frequent headaches. Have you noticed headaches cropping up more often lately? If these persistent headaches are becoming a regular issue, they could be a hidden sign of diabetes. It's easy to overlook the connection, but frequent headaches can actually be a symptom of elevated blood sugar levels. When blood sugar levels spike, it affects our body in ways we might not immediately recognize, like dehydration or changes in blood flow, both of which can lead to that throbbing pain we all know too well. When blood sugar levels get too high, one of the most common side effects is dehydration. Why? Because the kidneys start working overtime to flush out the excess sugar through frequent urination. The result? We lose more fluids than usual, leaving us dehydrated. When dehydration sets in, it can constrict blood vessels in the brain, causing the painful headaches that many of us experience. This can be especially true for people who struggle with poorly managed blood sugar levels. But it doesn't stop there. Another reason we might experience headaches when blood sugar is out of balance is due to hypoglycemia, or low blood sugar. When glucose levels drop too low, the brain doesn't have enough fuel to function properly, and that can trigger a whole range of symptoms: dizziness, confusion, and yes, headaches. The brain relies on a steady supply of glucose, and when that supply is disrupted, it sends out distress signals. Headaches are one of those signals. Studies back up this connection. In fact, research has shown that nearly 50% of people with diabetes report experiencing frequent headaches. That's a significant number. If you're dealing with other common symptoms of diabetes, like excessive thirst, blurred vision, or fatigue, frequent headaches could be another red flag that your blood sugar might be fluctuating more than it should. Recognizing these symptoms early is critical because the sooner we can manage our blood sugar, the less likely we are to experience these painful headaches. Hydration is an essential part of the solution. Drinking enough water is one of the simplest and most effective ways to help reduce the occurrence of headaches. Staying hydrated can support your body's ability to regulate blood sugar more efficiently and prevent the dehydration that often triggers those painful headaches. Just imagine the difference it could make. By drinking more water and keeping your blood sugar levels in check, you might notice fewer headaches over time. Sign 20. The mystery of unexplained weight gain. Unexplained weight gain, particularly around the abdomen, can serve as an early warning for type 2 diabetes. This isn't just about a few extra pounds. It's a signal from your body that something might be off. Studies have shown that insulin resistance, an underlying factor in type 2 diabetes, can lead to increased fat storage in this specific area. Even individuals who stick to a healthy diet might notice this change. It's a perplexing and often overlooked symptom, making it crucial to understand the connection between insulin resistance and abdominal fat. Let's dive into what happens. Insulin, a vital hormone, plays a key role in managing blood glucose levels. It allows our cells to absorb glucose, transforming it into energy. But when the body develops insulin resistance, this process falters. Glucose struggles to enter cells, and instead, it builds up in the bloodstream. Simultaneously, the body tends to store more fat, especially around the midsection, as part of this imbalance. The result is not only weight gain, but also the potential for rising blood sugar levels. The implications go beyond aesthetics. Abdominal fat is closely linked to a higher risk of complications associated with type 2 diabetes, including cardiovascular issues and further exacerbation of insulin resistance. According to a 2022 study, individuals with higher abdominal fat percentages are 60% more likely to develop heart problems than those without this pattern of weight gain. Recognizing this relationship is vital because it highlights the importance of addressing even seemingly small changes in weight distribution. What makes this symptom even trickier is that it can occur without other obvious signs of diabetes. You may feel perfectly fine otherwise. However, this subtle shift can precede more noticeable symptoms, such as fatigue or frequent thirst. That's why we should always remain proactive about tracking changes in our bodies. If abdominal weight gain feels out of the ordinary, it might be worth consulting a healthcare professional to rule out any underlying conditions. Fortunately, there's a way forward. Maintaining a healthy weight is not just about looking good. It's a powerful tool in diabetes prevention and management. A combination of balanced nutrition, regular exercise, and consistent sleep habits can make a huge difference. Research has shown that losing just 5 to 10% of body weight can significantly improve insulin sensitivity and reduce the risk of type 2 diabetes. Alright, so those are the 20 signs that could point to diabetes without you even knowing it. If any of those sound familiar, it's really important to see a doctor and get checked out. Early detection can make a huge difference in how diabetes is managed. When it comes to taking care of ourselves, it's all about making those small changes that add up, like eating a balanced diet, staying active, and keeping our weight in check. And remember, cutting down on sugar and those refined carbs is a big help for managing blood sugar levels. If you're already dealing with diabetes, things like medication, insulin, and regularly checking your blood glucose are going to be crucial. And don't forget, managing things like blood pressure and cholesterol is just as important in preventing complications. Speaking of complications, they can be really serious, but with proper care, they're preventable. We're talking heart problems, nerve damage, kidney issues, and more. So it's definitely worth staying on top of your health. Also, the mental side of diabetes matters too. Joining diabetes education programs and finding support, whether from family, friends, or professionals, can really help you stay on track. And don't skip those regular checkups. They're key for catching any potential complications early and ensuring everything's under control. With the right approach, people with diabetes can live long, healthy lives. So, if you noticed any of those signs or are just concerned about your health, don't wait around. Early action really does make a difference. Thanks so much for watching. If you found this helpful, be sure to like, share, and subscribe for more tips. Take care, and we'll see you next time.